Hello and welcome to my presentation on the roles and responsibilities of healthcare professionals. I'll be going through the following in this presentation and really explore the roles in which healthcare professionals play. The healthcare profession I've chosen to talk about specifically is nursing. I'll go into a brief history of nursing, discussing the changes in the roles and responsibilities in the profession. And also the career development, which is possible to be able to expand in nursing, the impact that the role expansion has had, the professional bodies involved in regulating nurses and what part they play, and evaluate the multidisciplinary approach within nursing. When we think of the beginning of modern day nursing, a name that we're familiar with is Florence Nightingale, one of the first pioneer nurses coming from an elite, affluent family in an era where women were not usually given an education and whose main expectations were to fulfill the role of wife and mother. Nursing at first was primarily seen as an extension to the role women did in the home as caregivers, with no formal training or medical knowledge apart from the knowledge passed down from their mothers or other women. It was seen to be a menial, low-class, untrained profession, and certainly not a job taken on by the upper classes. Florence Nightingale believed that the care of sick patients could be dramatically improved by using scientific principles and informed education about healthy lifestyles, and she believed that nursing provided an ideal independent calling full of intellectual and social freedom for women who at the time had very few other career options. Her work in the Crimean War vastly improved the lives of many soldiers, improving hygiene, dressing wounds, and making sure they were properly nourished. She would walk the wards at night, check on them, earning her the famous title of Lady with the Lamp. This eventually paved the way to her funding St Thomas Hospital in 1860, within it the Nightingale Training School for Nurses, and the beginning of the journey to training nurses to become highly specialised in a medical role. Mary Seacole, a Jamaican-born nurse and businesswoman from humble beginnings, had a prolific reputation in her home country. She wanted to come to London to also help in the Crimea. However, it was believed that she faced the racial prejudices of the time and was subsequently refused by the British government. So she self-funded the trip to London and was one of the first nurses to help soldiers directly on the battlefield. Her effort gained much admiration and respect from the soldiers, but sadly left Mary bankrupt and destitute by the end of the war. A mention should also go to Betsy Calderoy, who is not often recognised. She came from a humble background as one of 16 siblings. It is often said that she often clashed with Florence Nightingale due to their different social backgrounds, but training as a military nurse at 65, she served alongside Florence and Mary, spending time nursing on the battlefields of the Crimea in a heroic effort. Finally, we have Dorothea Dix, who was an advocate for getting better healthcare for the mentally ill in the early 19th century and during the time of the American Civil War. She was also known for treating both Confederate and Union soldiers, a practice which gained her respect from many. During a period when male doctors openly expressed disdain for female nurses, she continued to push for formal training and more opportunities for women nurses. She recruited more than 3,000 nurses and about 15% of the Union Army nurses over the course of the war. Although it was true that Florence was incredibly significant in establishing nursing as a highly respected profession, Betsy Calderoy, Mary Seacole, and Dorothea Dix all played their part in being the strong, resilient women whose efforts contributed greatly in different ways to set up what is the modern-day nursing profession we see today. The definition of a nurse, according to the Royal College of Nursing in 2004, is the use of clinical judgment in the provision of care to enable people to improve, maintain, or recover their health, to cope with health problems, to achieve the best quality of life, whatever their disease or disability, until death. The roles and responsibilities of a nurse have been constantly evolving and have come a long way in 150 years. Where nursing was seen as an outlet for social freedom for women in work, it has transformed into a role that includes extensive training programs with a higher level of medical prestige, better hospitals, facilities and technology, more responsibility and focus on patient care, along with the changing and rising demands within the NHS. This has also helped to transform the role. Some of the career options available in nursing is to be an adult nurse, mental health nurse, children's health nurse, learning disability nurse, school nurse, neonatal nurse, and prison nurse. And senior nursing roles, which are typically band 6, would be health visitor, team leader, junior sister, lead nurse, senior nurse, nurse practitioner, practice nurse, district nurse, triage nurse, nurse advisor, midwife and community midwife, ward matron and head of nursing. Developments in nursing. In 1948, the primary role for nurses was to care for and try to help ill people to become better. So much of nursing now is centred upon helping to prevent the individual becoming unwell in the first place. Nurses are involved in a lot more decision making than when the NHS started 70 years ago. At this time, nurses carried out the instruction of the doctor, but now nurses have become part of a disciplinary team and can now do things that were unthought of in 1989. Nurses can now, when appropriately educated and competent, diagnose, treat, prescribe and work autonomously. Nurses can carry out procedures such as endoscopies, even surgery. There are far more career opportunities for nurses now than they're ever imagined back in the 80s. Nurses are not seen as a doctor's assistant anymore, but as their own professional with the medical knowledge to back it up. There are also different fields of nursing which have become more specialised, and nurses can choose to work in a variety of settings, from patients' homes, schools, care homes and specialised areas such as prisons. Nurses can also combine a clinical career in education management or research. You could also work privately, and there's also an opportunity to work in health promotion as well as to advocate for a healthy lifestyle. So the career progression is very versatile. The population has grown subsequently, with people living longer with more complex long-term illnesses, and this puts more demands on nurses. And there is a lot of need for social care, which again transforms the role to being in the wider community as opposed to specifically just the hospital. So what are the impacts of these changes? The NHS has always had to deal with a constant rise in demand and a lack of funding ever since its introduction in 1948. But nurses and other hospital staff are currently being met with unprecedented strain and are dealing with unimaginable levels of anxiety and stress from being on the front line during the coronavirus pandemic. 8 in 10 nurses saying their mental health has been affected by COVID-19. According to a Nursing Standards Survey, a report from the Royal College of Nursing Research Society in May this year showed 24% of 4,063 nurses and midwives across the UK surveyed between the 28th of April and the 12th of May said they were suffering severe or extremely severe depression. And Office for National Statistics data published in March 2017 showed that the rate of suicide among nurses in England was 23% higher than the average between 2011 and 2015. However, there was a 10% shortage of nurses seen even before the pandemic hit, showing that this has been a long-term problem. In December 2019, the government pledged to increase registered nurses by 50,000 by 2024 to 2025. The number of nurses has barely changed since between 2010 and 2017. Steadily, the number of patients over the last 10 years has been rising, but there hadn't been the nursing workforce there to deal with the demands, with the NHS having to employ large numbers of support staff and healthcare assistants to try and bridge the void, and 5,000 nurses from overseas. A lot of nurses were getting burnt out, with a high staff turnover, with a national average for turnover rates being 8.8% to 37%, depending on the geographic location and nursing speciality. An ongoing dispute about nurses' pay and the fact that nurses now taking on greater roles filled with with a lot more responsibility than previously were, and with an increase in demand, may have also become a big factor in this shortage. The Royal College of Nursing states that applications were down by 30% since the student bursary was scrapped in 2017, with the government saying that it removed the bursaries to increase the number of nurse training places to help deal with the well-documented shortfall of nurses, midwives and health visitors, but also said the number of nurse training places available each year was limited to how much they could afford to fund. This number wasn't enough to supply the quantity of nurses needed by the health service, but it couldn't be increased because of constraints on government spending. In 2019, the bursary was again reinstalled, and in December 2019, the government pledged to increase the numbers. So hopefully this will release some of the pressures from the ever-increasing demands placed on nurses in the modern day. So the Royal College of Nursing sets out what is called here the Code of Professional Standards of Practice and Behaviour for Nurses and Midwives, something for all health staff to adhere to. So you've got to prioritise people, put people first and prioritise their safety and dignity, listen and respond to people, help those who cannot help themselves, assess and respond to people's physical, social and psychological needs, act in the best interest of people at all times, respect a person's right to privacy and confidentiality, practice in line with the best available evidence, communicate clearly, work cooperatively, share skills, knowledge and expertise to benefit patients and colleagues, keep clear, true and accurate records on paper or electronically, be accountable for decisions to delegate tasks to others, have indemnity arrangements to cover your practice in the UK, recognise and work within the limits of your competence, be candid about all aspects of care, including mistakes, offer help in an emergency within and outside your practice, act without delay if patient safety or public protection is at risk, raise concerns immediately if another person is at risk, be aware and reduce potential harm associated with your practice, promote professionalism and trust, uphold your position as a registered nurse or midwife, fulfill all registration requirements, cooperate with all investigations and audits, respond to any complaints made against you, and provide leadership, promote well-being and the healthcare experience. Professional bodies are important in regulating healthcare as they ensure safety, quality and assurance that the professional is adequately able to deliver the professional role to a high standard, and they can also investigate if those standards aren't met. The Nursing and Midwifery Council regulate nurses, midwives and nursing associates and work with the stakeholders. Professional strategic group who meet quarterly with senior nurses and midwives from the UK to ensure that they are an effective regulator and that quality is kept high. Like the Royal College of Nursing, they set standards of proficiency which they expect nurses and midwives to meet, and this protects the public, ensuring the best service. Nursing staff and midwives will apply to join their register, filling in an application so they can verify you're a trained nurse with a degree education and you're fit to practice. You won't be able to practice or be a registered nurse or midwife if you don't register with the Nursing and Midwifery Council. The Royal College of Midwives is a professional organisation and trade union dedicated to midwives. Established in 1881 as the Matron's Aid or Trained Midwives Registration Society, they also promote quality maternity services, promoting excellence, innovation and leadership. They work with many other organisations, including the Royal College of Nursing. Their ethos is promoting midwifery, quality maternity service and professional standards, supporting the members individually and collectively and influencing on behalf of members and for the women and families they care for. The BMA is an organisation that advocates campaigns and lobbies for the rights and conditions for all UK doctors and medical students. Everything from pay, working conditions, pensions and working hours. General Medical Council regulates doctors on a register, setting standard and quality assurance. The CQC, which is the Care Quality Commission, is also responsible for quality and safety provided by all social care and workers in the NHS, local authorities, private and voluntary organisations as stated by the Health and Social Care Act. The multidisciplinary approach is working as a team with other healthcare professionals in different areas of healthcare and expertise to maximise the way that you can look after a patient. The aim of this is to give a person-centred care approach, allowing the patient the best quality of life. For instance, in the case of a patient with heart failure, the multidisciplinary team would involve the GP, general physician, heart failure nurse, cardiologist, pulmonologist, pharmacist, dietitian, practice or community nurse, physiotherapist or occupational therapist, psychologist and social worker. They would all have something to bring to the table in discussing the overall aspect of the care to assess, diagnose, plan, implement and evaluate the care received. The advantages of the multidisciplinary approach are that you have more than one professional opinion and ideas about care from a different perspective. For instance, from another colleague in a health role that you are not specialised in. So instead of one expert, you have a team of experts. This should enhance your treatment. It also saves time because instead of individual referrals to each specialist, if they are all gathered in one room, then this saves waiting for the referral process and is more efficient. It is also a lot more resourceful as you have access to all types of equipment and immediate use. It allows the patient to set themselves goals that can be discussed with the whole medical team to be implemented in the best way due to their medical expertise. It becomes more person-centred with the patient and their family feeling more secure in the reassurance that the best outcome of living can be achieved. Some of the cons are that to discuss every individual patient in such a methodical and detailed way can be time-consuming for the medical staff. It can take 2 to 3 hours per meeting. So it also means that strict individual deadlines for the patient will have to be met, otherwise it will hold back the entire collaborative effort as the other staff will not be able to make informed decisions as easily. This puts intense pressure on an already strained NHS. In theory, it's the best idea for patient care, but in practice, specialists are on different schedules and it may not be so easy to discuss individual cases due to an excessive workload, and collaboration will need to occur frequently if the aim is to provide the best level of care, and also resources may be limited too. Thank you for watching my presentation.